Japan was one of the first few countries to have confirmed coronavirus, COVID-19 cases, but their handling of this pandemic was often criticized. We're here to share all that has happened and is happening right now in Japan. We have created this video with information from Japanese and English media, social media, surveys, and interviews. All of the data were collected before the 9th of April. For the most updated information, check out our article in the description box below. We will discuss the COVID-19 related events, the current situation in Japan, events affected by COVID-19, the support from government and companies, lockdown and state of emergency, and how both Japanese people and foreigners in Japan view the effects of this pandemic. To understand the situation in Japan, let's go back to January. The first official case of coronavirus in Japan was a 30-year-old Chinese national who traveled to Japan on 6th of January. 28th of January marked the first case of infected Japanese national, and on 3rd of February, the first travel ban was implemented. Diamond Princess docked at Yokohama port and began the quarantine on the 5th. On 13th, a woman in her 80s passed away after being infected with coronavirus, marking the first COVID-19 death in Japan. We will link the timeline that you can check out in the description box down below. One big incident in Japan's battle with COVID-19 was the Diamond Princess cruise ship. On 25th of January, a passenger in his 80s disembarked in Hong Kong and later tested positive for COVID-19. The cruise ship then returned to Yokohama on 3rd of February, and their entire ship was quarantined for 14 days from the 5th of February. Passengers were requested to stay in their cabins and were only allowed to walk around on deck for a few minutes every day whilst wearing masks. Their meals were brought to their rooms along with movies, newspapers, and games. Crew members continued to sleep in small cabins and eat with each other, and also came into contact with those who had been tested positive. David Fisman, an epidemiology professor at the University of Toronto, told Fox, "They've basically trapped a bunch of people in a large container with the virus, so I'm assuming quarantine is generating active transmission." More than 700 people were infected and 8 people died. Fast forward to today. What is Japan's current situation? Like everywhere else in the world, masks and hand sanitizers are sold out nationwide. Toilet paper, wet wipes, and other household items are in short supply. The streets are largely empty. Many establishments have shortened their opening hours or closed their doors temporarily. Many schools are closed or conducting online classes, and perhaps most outstanding of all, the 2020 Tokyo Olympics has been postponed by a year. As of 8th of April, Japan, with a population of 127 million people, has more than 4,250 cases of coronavirus and over 90 deaths. Japan has tested about 55,300 people, which comes to roughly 437 tests per million people. Entry from over 70 countries and regions into Japan is currently being denied, including the United States, most of Europe, Canada, Australia, Singapore, Malaysia, Indonesia, and China. Visa applications are also suspended for the time being. Various attractions and popular destinations are closed. These include Tokyo Disneyland and Disney Sea, Tokyo Skytree, various museums, and aquariums. Hanami, cherry blossom viewing, is a popular activity during this time. To prevent people from gathering, there are security guards in parks such as Ueno Park or Yoyogi Park to stop people from entering. Prime Minister Shinzo Abe has requested that all schools close, but some are delaying closures and some are refusing to close altogether. As locals are advised to stay at home, restaurants, shops, karaoke joints, and other entertainment facilities have shortened their opening hours or temporarily closed, especially since the beginning of April. Just above 13% of full-time workers are working remotely as of mid-March. People continue to commute during rush hours. The government has called for large-scale events such as festivals to be postponed or cancelled. In spite of this request, some events went on as planned with certain precautionary measures. The Grand Sumo tournament took place as scheduled, but special measures were taken. Audiences were barred. The matches were streamed online for fans to watch. On 21st of March, the Japan Olympic torch event continued as planned in Sendai. Despite calls to the public not to attend, the event gathered more than 50,000 people. The audience members formed a line of around 500 meters for several hours. K1 World GP is a popular martial arts competition that gathers 10,000 people every year, and it was held in Saitama Super Arena on 22nd of March. The organizers implemented certain measures such as reducing the number of seats to 6,500. Their decision not to cancel the event gathered criticism, such as this tweet that says, "The organizers of the K1 World GP do not understand the dangers of the coronavirus at all." 38,000 runners from around the world were set to participate in the Tokyo Marathon 2020, but the organizers announced that only elite runners and wheelchair athletes were allowed to join this year, reducing the number to just 200. No refunds were given to runners who were no longer able to participate. The Japanese government has continued to adapt and provide different kinds of support for people that are affected by the COVID-19 pandemic. Households whose income declined sharply for reasons related to COVID-19 can receive a relief package drafted by the government with the estimated value of 300,000 yen. The government increased the allocated funds to companies affected by COVID-19 to 5 trillion yen. This fund allows companies, especially small to mid-sized companies, to take loans from government-affiliated banks. The government has decided to allocate 1 trillion yen to the tourism industry, subsidizing domestic travel fares and accommodation fees. With the sudden announcement of school cancellations, many Japanese employees had to take a leave of absence from work to care for their children at home. The government created policies such as creating subsidies for these employees. Other organizations and companies have also created different support. The president of Rakuten, Hiroshi Mikitani, offers 598 rooms at his hotel, Parkfront Hotel, free of charge to house those with mild symptoms. Paralympic Support Center will accommodate 1,200 people with mild symptoms and hopes to increase that number to 10,000 in July. Campfire, a crowdfunding platform, has launched crowdfunding support for small businesses, independent artists, restaurants, and lodging facilities, and each company has since received millions of yen in donation in exchange for small gifts or services. Some financial relief packages exclude those working in the nightlife and adult entertainment industries, though the government has announced that they will reconsider it. Foreign residents' eligibility for financial support is also currently being discussed. The requirements for a household to be eligible for financial support are so complicated that even official media outlets find it hard to understand. While requirements vary from prefecture to prefecture, this is a general guideline. A household is eligible for financial support only if the household income is lower than a certain number during the pandemic. These numbers are extremely low, allowing very few households to be eligible. Let's have a look at exactly what actions Japan can take. It's unclear what a lockdown would mean in Japan. It could mean that incoming and outgoing flights are banned, or that residents are confined in their homes, or both. In countries such as France, Italy, and United Kingdom, it's both, and violators of the lockdowns are fined or have to face jail time. Legal punishments cannot be carried out in Japan, as Japan's special measures law states that confinement cannot be legally enforced, only requested. So basically, all the government can do is ask. The rest depends on Japan's residents. After weeks of pressure on Prime Minister Shinzo Abe to declare a state of emergency, he finally did on 7th of April. The new measures cover a total of 7 prefectures: Tokyo, Osaka, Chiba, Hyogo, Saitama, Kanagawa, and Fukuoka. The prefectural government would be able to request that residents stay home. Request in Japanese is yosei, and although it's often translated to request, it's understood as demand and is likely to be obeyed by a concerned population. The governors can now request that schools, childcare facilities, movie theaters, and other public facilities be temporarily closed. As for offices, the prefectural government would demand that they thoroughly implement infection control measures. While there are no official penalties, establishment, facilities, and offices that disobey will be at risk of being forcibly closed and then outed publicly. Tokyo Governor Koike Yuriko announced that residents will still be able to leave home for food, medicine, and visits to the hospital. Public transportation will keep running. Businesses will be categorized into 3 groups: ones to close, ones asked to close, and ones that are essential. To get the most up-to-date information about the current situation in Japan, check out our article that we'll link in the description box below. Are Japanese people working from home? As mentioned before, only 13% of full-time workers have begun working remotely during this pandemic as of mid-March. When asked why they were not implementing remote work procedures, 41.4% of respondents answered that they have not established remote work systems. 39.5% was that the company did work that could not be done remotely. 64.9% of employees said they didn't receive any specific instructions or saw any changes within the company to change commute hours, and 67.8% responded that face-to-face company meetings were still held as usual. This may be due to Japan's working environment. There is a very strong group mentality as compared to other countries, and decisions within the company have to be made together. Japanese employees have very little individual say, and decisions can't be made by one person. Companies are also accustomed to old practices such as using fax machines. All of this makes transition to remote work very difficult. Let's look at what people think about the coronavirus COVID-19 pandemic in Japan. According to a survey that we conducted, here are some of the main precautions that people in Japan are taking. Wearing masks, working from home, avoiding crowded places, washing hands and using hand sanitizers, protecting immune system with less alcohol consumption and more quality sleep, cancel travel plans, stocked up on essential food and groceries, and distancing physically from others, especially elderlies. Here are some things people in Japan have to say about coronavirus. Japan has the most drastic aging population in the world, with 33% of the population above the age of 60. Some are scared for the elderlies, saying similar to Italy, there are too many elder people and they would die without receiving treatment. This tweet is saying, just because you're young, you could still get the virus and pass it on to an elderly. It is no different than murder. Some schools in various prefectures are operating as per usual, and a petition to close the schools in Hyogo Prefecture gathered 19,000 signatures. Since then, the schools have decided to close until April 19th. Talks of reopening schools gathers criticism online, such as this tweet that says it would be an absolute mistake and that the coronavirus would explode in an instant. Ken Shimura, a famous Japanese comedian, passed away due to COVID-19, and his death was a wake-up call to many. There are some who don't think the COVID-19 pandemic is an issue at all and believe that because they're young, they'll be fine.
全く怖くないですいやコロナマジでなんかインフルのちょっと強めみたいなコロナでみんな死なないと思ってるんですよまあ若者は何とかなるでしょう
One of the responses is trending, and the guy says, if I dance hard enough, the coronavirus will be blown away. We asked different people what they think about how the government is handling the coronavirus situation. Caitlin from the UK said, prior to the Olympics being postponed, they were clearly under testing in the hopes of keeping the games on schedule. Money and a thriving economy will always be more important than the lives of citizens. Clara, who is half Japanese, half Irish, said, the government is being very irresponsible. In press conferences earlier on, not everyone was wearing masks. Prime Minister Abe said that some schools should open in April, but would have to take precautions like opening windows. It's laughable. They need to test as much as they can and release the data. Julia, who is half Japanese, half Swedish, said, very mixed feelings. I do believe that more testing should be done in Japan, but at the same time, I understand that testing for non-essential cases is just going to overwhelm medical facilities that should be focusing their resources and energy on treating those who are severely ill. Some people are skeptical of the steps the government has taken and are questioning their competency. Many people are making fun of one of the policies that Abe announced, which is to provide 2 masks to each household. Many memes have been circling the internet. Some sympathize with Prime Minister Abe and government officials and think that social media and media have contributed to the fear and miscommunications. Why doesn't Japan have a higher number of cases? This may be due to certain parts of Japanese culture. Japan is one of the cleanest and most hygienic countries in the world. There's very little litter on the streets, and the public facilities and public transportation are thoroughly cleaned and managed. Japanese people usually greet one another with bows, nods, or waves as opposed to handshakes or hugs. Even when you pay in restaurants or other establishments, you typically put your money on a tray rather than in the other person's hand. Wearing masks was already common in Japan, especially during this time in spring, as a number of people in Japan are prone to hay fever. It has been influenza season, and Japan tends to have higher vaccination rates and control measures that also help limit COVID-19 spread. South Koreans and Chinese are the majority of tourists in Japan, and they were barred by their governments from leaving their countries due to a lockdown. This drastically reduced the number of people entering Japan and helped slow down the spread of COVID-19. Many are asking if Japan is testing enough. To get tested in Japan, you have to have the following symptoms or experiences: a fever for 4 consecutive days, contact with someone who has tested positive or been overseas, have trouble breathing. A local consultation hotline is available for people to call and communicate their symptoms and possibly get tested. This graph shows the steps taken when symptoms appear. Some have expressed that the process of getting tested is long and complicated. This tweet is by a doctor. It says, "I'm a doctor in active service. It's a lie that doctors are conducting PCR tests on those who have died of pneumonia and suspected of COVID-19 infection. Almost no PCR test for unsuspected patients is conducted." Prime Minister Abe said that the PCR screening capacity of Japan will reach 20,000 per day. However, it is apparent that only just about 40,000 tests have been conducted so far. Many people have expressed difficulty in getting tested. On Twitter, countless accounts have told their stories and expressed their frustration about their attempts to get tested in Japan. We have asked Emma, a friend that is passionate and has created a Twitter account translating coronavirus information into English, to tell us a little bit more.
About 2 weeks ago, I had tonsillitis, which I always get all the time. And I went to the doctor because I had a fever and a sore throat. I also asked the doctor to be safe, like, is there a chance that I have coronavirus? Because it was, going around. And then the doctor asked me, like, have you been out of Japan in the last 2 weeks? Have you been in contact with somebody infected with the virus? I said, no. Well, the second question, I don't know because, I'm always in a cafe. And the doctor was like, well, if you're not coughing, if it's just a sore throat, then it's impossible that it's coronavirus. You don't need to get tested. And I was quite shocked to hear that because I heard that 80% of the people actually have light symptoms and they may not, check all the criteria for coronavirus. And especially this doctor that I always go to, he usually recommends that I get tested for things like influenza. But this time I felt like there was some kind of pressure that's stopping him from, testing me with the PCR test. I was looking around on Twitter and I found out that there were so many people who were, who had a high fever for over 2 weeks, coughing, and had all the symptoms for coronavirus, and still weren't able to get tested. They had to call the public health center, and then they're like, "Oh, if you haven't been to China, or if you haven't been outside of Japan in 2 weeks, like, we cannot test you." And then they go to the doctor, and the doctor's like, "We cannot do anything about it, so call the public health center." So I was like, wow, this is a serious issue, right? So then I decided to create this Twitter account called @COVID-Japan to retweet these voices of Japanese people who are saying that they were not able to get tested even though they have all these symptoms. And I've been translating them into English. I thought people need to know this. And after I created the coronavirus account, COVID-Japan account on Twitter, a few people reached out to me, like telling me like more similar cases, and they wanted help. Before I had this personal experience, I wasn't freaking out at all. I thought it's fine. Like, there's only 10 people who were infected in entire Japan, and I live in a city with 10 million people. So what's the chance that I'm going to get infected, right? And I think a lot of people felt the same way. They weren't panicking because we were hearing these numbers that seem so low compared to the rest of the world. And I was thinking, like, oh, it's because of the distant culture that we have in Japan. Like, we don't shake hands or we don't hug each other, and we're, pretty clean and hygienic in general, that we weren't affected as much. So yeah, I think it's completely normal that people were not, being super careful about it because they're misinformed, basically. I went to the government website to look at the statistics of people who actually call the coronavirus hotline asking for tests, and people who actually got the test, right? And in Tokyo, there's been about 40,000 people that called the hotline, and out of those, 97.7% of the people were rejected from getting tested. So it's a huge number. And when you compare this number to other countries, out of 1 million people in Japan, only 365 people got the test, right, as of today. When you compare this number to the US, it's 5,000 people per million people. The state of emergency is called. I think people will have less and less reasons to go out. So I think that's going to help a little bit. Although by Japanese law, you cannot enforce, people to stay home. There's going to be no penalties for people going out. So it's never going to be 100%, but it does help. I personally feel like a lockdown is necessary, like a complete lockdown, but obviously people need to be supported financially for that to happen. So that's another thing that I'm concerned about.
Although the state of emergency has been called now, people are still going out to work, and it's hard to imagine the numbers going down with a large amount of commuters, people going out, visiting restaurants with no legal punishments. Is Japan too late to the game? How much worse will things get before they get better? Time will tell. We're constantly providing latest updates in our article, which we will link in the description box down below. Hope this video was able to help you get a more in-depth understanding about the coronavirus COVID-19 situation in Japan. If you have any comments or thoughts, please let us know in the comment section down below. Thank you very much for watching. Take care and stay safe.